Blackrock Clinic is a 168-bed acute hospital spread over 5 floors. We have 8 operating theatres. We carry out surgery in orthopaedics, cardiac surgery and general surgery. At present in Blackrock Clinic we have a number of opportunities for nursing staff who may be considering working in Dublin, Ireland, returning or visiting for the first time. We are also looking for staff who have experience in high dependency or critical care in the general ward, and we will certainly support them if they have an interest in working in this area.
Our vision is clinical excellence personal care, and this is emphasised from day one when you join this hospital. We are looking for staff or nurses who will, I suppose, embrace these values and understand what they mean in terms of the patient experience here in Blackrock Clinic.
My name is Kate Hennessy. I'm the chest pain nurse specialist here. For me is when I come in, I get a report from all the cardiac patients on the ward and how they were overnight. I go through their telemetry monitoring to see was there any changes in their heart rhythm overnight, and I then go and see the patients individually and report back to the cardiologist on any tests or results that are back on them. So I carry a bleep then, so basically if anybody comes into the emergency department or needs me on other floors, if there's cardiac patients on other floors where they need them assessed and need to liaise with cardiologists, I'll do that as well. It's a great working environment. All our equipment is very new. The departments are very spacious. It's a very comfortable environment to work in. Well, I really enjoy working in Blackrock. I suppose my role, I am fortunate that I can work with different departments and different members of the team. I have made great friends in the Blackrock Clinic, and it's just a very enjoyable working environment. Blackrock is situated in a very nice part of Dublin in the south side, very easily accessible with DART and train lines and bus routes.
I was aware that Blackrock Clinic is known as a centre of excellence worldwide and in Ireland, and I thought it would be a great opportunity for me to seek a job there. Also, I was aware that Blackrock Clinic was a private hospital, and it's very recognised in Ireland as well as one of the best private hospitals. Well, our shift starts at 7:15, finishes at 9:15. Handover usually from the night staff is for about a half hour in the morning. So then we just get our patient load, just check the patients, make sure they're okay first thing in the morning. Then we do the medication round, just their OBS, like their blood pressure and temperatures. If they're on a heart monitor, we just print off strips. Then there's also doctor's rounds, washes. Blackrock Clinic, every room is private, so this maintains good privacy as well for the patients. And as well, you build up a good relationship with the patients, them being in the private rooms. Also, we build up a good rapport with the doctors and the physios and the rest of the multidisciplinary team, because we all work quite closely together for the patients' well-being. The workload could be quite tough and challenging, but at the same time it's quite exciting, and it's a good learning opportunity as well on the ward.
I mean, be it that I'm here 23 years, I've moved up the ranks from a staff nurse to working part-time for a while, and then I went back and I studied. So I was assisted in all of that with study leave and financial assistance.
When you start first to the organisation, you get an orientation, a full day's orientation, explaining about the organisation. You're introduced to this clock-in system, which is a fingerprinting system for each individual person. You're introduced to that by human resources. Then when you start from a nursing point of view, when you start at ward level, you're given orientation depending on the area you're working in, 2 to 3 weeks orientation where you're buddied up with another colleague who's on the ward, and you have an orientation pack, so they will go through that to make sure that you're comfortable with all aspects of the care on the ward that you need to be proficient in to work in that area. Yes, if you were enthusiastic, there's certainly the resources there to further your education. Well, on our ward, we're a pilot ward for a new drug administration system called Omnicell, and it's actually started up and running this week. So this system is a computerised system, and you key in the drugs that you want, and it immediately lights up the drawer that you're to open. When the drawer opens, the spot that the drug is to be administered from is lighting, so you take the drug from there and it's always going to be there. There'll be no more running to pharmacies.
There is great job satisfaction here. We do see a good turnover of patients. Procedures, as I said, can be done quite speedily, and we see patients go home much better than when they've come in. We deal with patients who are very acute, from people who've very bad valve disease to acute heart failure, and we do have the best treatment available here, and we do most of the time get patients back to near full recovery. And the fact that cardiology is so unpredictable, we really don't know what we're going to walk into that morning, or what type of emergency that will come upon us at any time of the day. So that can be quite exciting and rewarding when there's a good outcome for the patient.
Yes, you have to be a certain type of person to stick with it, because it can get you emotionally. And it's certainly a role that you can work in for a certain period of time and say, yes, this is for me, I do get a job satisfaction out of it, or you'll realise very quickly, no, this definitely is not for me. It's that type of area to work in.
The relationships I've built up with a few of the girls on the ward, it is hard work and it is challenging during the days, but at the same time, we all do get on very well and we work quite close together. So it's easy to come into work when you get on well with your colleagues.
Well, it's a beautiful environment. And the office we're in, when we see patients in pre-admission, so they come a few weeks before their surgeries, and they look out onto the sea, and the one thing they always say to us, this is beautiful, you have a lovely office.
Well, the parking is a major bonus. In a lot of hospitals, especially inner city, parking is a major problem, and here there's a 5-storey parking lot, so it's very, very handy. Less stress in the mornings as well. You're not worried about where you're going to park your car. Also, the restaurant is quite nice. The food's lovely in the restaurant, and it's supplemented for staff, and the view is lovely as well. Yeah, well, a lot of people that did move away a few years ago during the recession, they are starting to move back now. And again, the Blackrock Clinic is a nice place to work. The staff, I find everywhere very friendly, and as well, the education is very good. Patients as well are very nice here, and it is a very easy transition to make if people are thinking of moving back to Ireland. It's a good place to work.